Hello everyone and welcome to another Avazia Life Pinnacle training video. Today we're going to be talking about the crucial vagus nerve stimulation protocol. If there is one protocol that you take away from your microcurrent device that you will be using on patients, clients, or yourself, it's probably going to be vagus nerve. Practice this one if you find it hard, because even though it's simple, some people do find it a bit of a challenge, but the rewards are well worth it. Typically, once you've started doing this, you're going to be good to go. It's really simple, and this video is going to simplify it. Hopefully more than the manuals often seem to do, because people tend to get a little bit confused by the pictures and things. So first, let's talk briefly about what the vagus nerve is. Now, the vagus nerve is the 10th cranial nerve in the body, and it interfaces with the parasympathetic control of the heart, lungs, and digestive tract. The yellow lines in that picture right there, that is the vagus nerve. See how much of your body it touches. All of those vital organs being affected by this one nerve. Now, the key to why vagus nerve stimulation is so effective is in that sentence I just read out. Parasympathetic control of the heart, lungs, and digestive tract. Now, parasympathetic states in the body are critical for rest, digest, assimilate, and repair states. This is your alpha state. If you are in chronic pain, if you are heavily inflamed, your vagus nerve is not going to be in a parasympathetic state. Your body is not going to be in a parasympathetic state. You're going to be in a fight or flight mode because your body is fighting to survive. Now, the vagus nerve can place these critical organ systems, all these ones you're seeing in the picture, in a state in which they are able to rest and repair. And this is because it blocks the production of inflammation. So vagus nerve stimulation is something that you should all be capable of doing and utilizing in order to maintain optimum health. Vagus nerve stimulation works to eliminate inflammation throughout the body. It does this by blocking tumor necrosing factors and the production of them in the spleen. And thus, this is the treatment that should be done a few times a day to train the vagus nerve to begin to function in this way without microcurrent intervention. So by stimulating the nerve, you're going to block this production of tumor necrosing factors and physically block the creation of unwanted inflammatory response. This will eliminate pain. This will enable the body to heal. And this will enable people who are in chronic disease states to finally get out of that fight or flight mode. When pain and inflammation are gone, the body can begin to heal. So the treatment tools that we recommend for this, there's 2 of them included in your Pinnacle kit, if you got the deluxe kit of the Pinnacle. This will be the vagus nerve pad, which looks like a little kind of miniature bow tie, I guess, and the Y electrode. Everyone seems to have their own preference as to which method they prefer. I found both to be effective. I find sometimes holding the vagus nerve pad on with my fingers is more comfortable than holding a Y probe. So either one can work. But the Y probe is the most commonly used, especially if you're using it on clients or patients, because it's just got that flexibility of being able to be cleaned easily. The tip of the Y probe here, these 2 metal balls, are stainless steel, medical grade. They can be cleaned with rubbing alcohol. I just use rubbing alcohol swab between patients to make sure that they are disinfected. And this is especially important if you're treating anyone that has any skin conditions, but you should be maintaining use of your equipment and proper cleanliness as you move through. The pad, a lot harder to do that. So pad is probably better reserved for personal use. So we have 2 different types of vagus nerve treatments. Both are good. The standard treatment's better. The standard treatment and the emergency pain treatment. We're going to cover both of them here. You see in this image the placement of the vagus nerve pad or Y electrode and where it goes in order to tap into that vagus nerve. So standard vagus nerve treatment, this is the one that if you are familiar with vagus nerve, you're probably most familiar with. You locate the carotid artery on the left side of your neck, not the right. The left side interfaces with the digestive organs and is going to be controlling the inflammatory response. The right side vagus nerve only really gets stimulated in cases of chronic PTSD following the what do you call it? The polyvagal theory video, which you'll probably be able to find in this training library, or in the case of anything to do with lungs and heart. Those are the times when you're going to want to use the right side. Otherwise, the left side is where we go for our daily health treatments. So you're going to look for a pulse in the neck. Just feel with your finger. When you find it, crawl back a little bit on the behind it and put the electrode right there. You're going to then set your device to the mode named 7 to 12 hertz. And you're going to hold that plus button down until you feel a tingling. It's going to kind of quiver in your neck a little bit. You treat for 3 minutes. You've got a timer on your screen. And once you've treated for 3 minutes, you're going to stop. You can do this up to 4 times per day. Some people find that they need to do it longer. If you're in a really chronic state or you don't have time to do it 4 times per day, doing it for upwards of 20 minutes at a time, it's kind of my cutoff point, is going to be fine. It's going to help your body to get into that parasympathetic state. Sometimes you need to do it for longer to push through and actually get into that area where you feel calmer. As you're doing it, try and close your eyes, try and relax, and wait for that moment where you kind of let a breath out without intending to. You'll notice that's when you've hit that parasympathetic. So if you feel that you're not getting relaxed, you can do this standard treatment for longer. Otherwise, 3 minutes, 4 times per day. Breakfast, lunch, dinner, bedtime. Those are the optimum times because it's just a good way of remembering when to do it. Emergency vagus nerve treatment is different. This is reserved for chronic pain that's come on really fast, like a flare-up, chronic headaches, CRPS, that's complex regional pain syndrome, flare-ups, or any immediate intervention. You locate the carotid artery just the same on the left side. You look for a pulse. You crawl behind it a bit with your fingers, and you put the paddle, the electrode, in that spot. And then you set the device to 121 hertz. Okay, different program, 121 hertz. You adjust the power until you can feel a gentle tingling. And then you treat until you get relief, but you do not exceed 3 minutes. You may find you get relief in 10 seconds, but you do not go for longer than 3 minutes, and you do not do this more than once every few days. This is a lot of current to put onto the vagus nerve, and it should be reserved for emergency pain, not for general daily treatment, okay? Let's go back briefly here, and I will show you how to do this on me. Okay, so I've got my Pinnacle here. I've got my Y probe plugged in already. I'm gonna turn it on, and I'm gonna set it down to 7 to 12 hertz. When I found 7 to 12 hertz, got a lot of programs to go through in this device, I'm gonna hit the middle button. So hit that middle button with the Santa logo to lock in 7 to 12 hertz. Now, I'm not gonna adjust the power yet. So what I'm gonna do is I'm going to, on my left side of my body, I'm gonna feel for my carotid artery. So I'm gonna stop talking while I can feel it. Okay, there it is. So I was actually right on it. It shows you I practice a lot. And I'm gonna go back just a little bit, like that. And that's where I'm gonna put the electrode, right around there. Now, you'll find that this often means, and I'm hoping it's right because I can't see my own side of my face, that I am about an inch below the earlobe. So about an inch below the earlobe, yeah, I can feel it. I'm touching one of the balls of the Y electrode. So if you can't find your carotid artery, if you're struggling to find it for whatever reason, go an inch below your earlobe, start the Y probe there. Now, I'm going to increase the power to the point where I can feel it, okay? By holding that plus button down. Okay, so I can feel it. And you don't want to put too much pressure, gentle pressure on the neck. You may be able to observe my neck twitching here. I can feel it a little bit. You're gonna feel it when it's doing this, and you're gonna probably be able to see it if you were looking in a mirror as well. So there's a timer on your device. You can hit the middle button to reset the timer to 0, and you can start from there. Now, you would do this treatment for upwards of 3 minutes, maximum 20, and this is the basic vagus nerve treatment. Now, you would do the same treatment if you needed to with the emergency one, 121 hertz instead, but in the same spot. So let's see. Oh, you can barely see it. You can barely see it twitching, but you'll feel it. Around the few minutes mark, 2-minute mark or so, you may feel it kind of in your stomach, like that feeling of going down a roller coaster where your stomach jumps. You might feel that a little bit. It doesn't always happen, but it does sometimes. I found it happens more commonly in women, which is an interesting observation. But it is definitely something that does sometimes happen. But as long as you're feeling it on your neck there in that spot, feeling the twitching, feeling the current going in, you're in the right spot for the treatment. Okay, let's get those slides back up again, shall we? Okay, so thank you very much for watching. Treatment of the vagus nerve can dramatically enhance the healing process. Practice this technique, perfect it, and you'll find it's going to be a crucial tool in your healing kit. Thanks for joining me, everyone. See you in the next video.